There is one food that has been consumed by human beings for thousands of years that appears in more published research studies than almost any other single dietary ingredient, and that scientists studying longevity, heart health, brain health, and cancer prevention keep returning to again and again. It is not a superfood discovered in an Amazon jungle. It is not a newly isolated compound from a laboratory. It is something most people already have in their kitchen, or think they do, but have probably never fully understood what it is actually doing inside their body from the moment it is consumed. Today we are going to answer that question completely. We are going to go through every major system in the body and explain specifically what extra virgin olive oil does there, why it does it, and what the research says about the magnitude of these effects. Stay with us until the very end, because the final body system on this list is the one that surprises almost everyone, and it represents one of the most exciting areas of current olive oil research. Before we go system by system through the body, let's spend a moment understanding what makes extra virgin olive oil genuinely different from other fats, because this foundational understanding explains why its effects are so wide-ranging and so remarkable. Extra virgin olive oil is composed primarily of monounsaturated fatty acids, predominantly oleic acid, which account for roughly 70 to 80% of its fat content. But the fatty acid profile alone does not explain its extraordinary range of biological effects. The difference maker is the polyphenol content, a diverse family of plant compounds including oleocanthal, hydroxytyrosol, oleuropein, and squalene that are unique to extra virgin olive oil produced by cold pressing fresh olives without heat or chemical processing. These polyphenol have antioxidant, anti-inflammatory, antimicrobial, and neuroprotective properties that operate through specific biological mechanisms in nearly every tissue of the body. Critically, these polyphenol are present only in extra virgin olive oil and are largely or completely absent from refined or regular olive oil that has been processed using heat. This distinction between extra virgin and refined olive oil is not a marketing differentiation. It is a fundamental difference in biological activity, and it is why the research we will discuss is specifically about extra virgin olive oil rather than olive oil in general. Let's start with the cardiovascular system, because this is where the research is most extensive and the effects most clearly established. Extra virgin olive oil has a direct, documented, and significant impact on heart and vascular health through multiple simultaneous mechanisms. The first is its effect on the endothelium, the single cell layer lining every blood vessel in the body. The endothelium produces nitric oxide, the compound responsible for blood vessel dilation and healthy blood flow regulation. Endothelial dysfunction, the reduced ability to produce nitric oxide, is one of the earliest markers of cardiovascular disease and one of the most important contributors to high blood pressure, poor peripheral circulation, and atherosclerosis. Research has consistently found that the polyphenol in extra virgin olive oil, particularly hydroxytyrosol and oleocanthal, directly support endothelial nitric oxide production, improving the ability of blood vessels to dilate appropriately and maintain smooth blood flow. This endothelial protection is measurable in clinical studies and produces real-world outcomes including reduced blood pressure readings and improved peripheral circulation that people can feel. The second cardiovascular mechanism is the anti-inflammatory effect of oleocanthal. When you consume a high-quality extra virgin olive oil and notice a slight peppery, burning sensation at the back of your throat, that sensation is produced by oleocanthal interacting with the same pain receptors that ibuprofen activates. Oleocanthal inhibits the same inflammatory enzymes, COX-1 and COX-2, that ibuprofen and other nonsteroidal anti-inflammatory medications block, but it does so as a dietary compound rather than a pharmaceutical, and without the kidney, liver, and gastrointestinal side effects that accompany regular medication use. For the cardiovascular system, this anti-inflammatory effect is profoundly important because chronic inflammation in blood vessel walls is the driving force behind atherosclerosis, the plaque buildup that narrows arteries and eventually causes heart attacks and strokes. The PREDIME study, one of the largest and most rigorously conducted dietary intervention studies ever conducted, found that people following a Mediterranean diet enriched with extra virgin olive oil had a 30% lower risk of major cardiovascular events, including heart attack and stroke, compared to those following a low-fat control diet. The third cardiovascular mechanism is the effect on blood lipids. Oleic acid, the primary fatty acid in olive oil, when consumed as the dominant fat in the diet in place of saturated fats, consistently produces a favorable shift in cholesterol profile. It reduces oxidized LDL cholesterol, which is the form of LDL that directly contributes to atherosclerotic plaque formation. It supports HDL cholesterol levels, which carry cholesterol away from blood vessels. And it reduces triglyceride levels. This lipid-improving effect, combined with the endothelial protection and anti-inflammatory action, makes the cardiovascular protection from extra virgin olive oil genuinely comprehensive rather than targeting only one aspect of heart health. Moving to the brain, the research on extra virgin olive oil and cognitive health has become one of the most compelling and fastest-growing areas in nutritional neuroscience over the past decade. The brain is composed of approximately 60% fat, and the quality and type of fats consumed in the diet directly influence the composition and function of the membranes surrounding every neuron. Oleic acid from olive oil is incorporated into neuronal membranes, where it influences the fluidity and receptor function of those membranes in ways that support efficient neural transmission. But beyond the structural role of oleic acid, the polyphenol in extra virgin olive oil have attracted remarkable research attention for their specific effects on brain health. Oleocanthal has been studied for its potential to enhance the brain's clearance of amyloid beta, the protein that accumulates in the brains of people with Alzheimer's disease and is considered a primary driver of its progression. Research in animal models has found that oleocanthal enhances the function of the blood-brain barrier transport mechanisms responsible for removing amyloid beta from the brain. Human epidemiological research has found consistent associations between adherence to the Mediterranean diet with extra virgin olive oil as the primary fat and lower rates of cognitive decline and dementia in older adults. The brain also benefits from olive oil's anti-inflammatory and antioxidant effects at the neural level. Neuroinflammation, chronic activation of the brain's immune cells called microglia, is increasingly recognized as a central driver of neurodegenerative disease progression and age-related cognitive decline. The polyphenol in extra virgin olive oil cross the blood-brain barrier and exert anti-inflammatory effects within brain tissue, potentially reducing the microglial activation that drives neuroinflammation. Hydroxytyrosol in particular has demonstrated neuroprotective effects in research settings, supporting neuron survival under conditions of oxidative stress that would otherwise cause cell death. The digestive system is another area where extra virgin olive oil produces significant effects that most people are unaware of. Research has found that extra virgin olive oil polyphenol function as prebiotics, feeding the beneficial bacteria in the gut microbiome while reducing the populations of harmful bacteria. Studies comparing the gut microbiome of people consuming extra virgin olive oil with those consuming other fats have found higher diversity and greater abundance of beneficial bacterial species in the olive oil group. Higher microbiome diversity is consistently associated with better health outcomes across virtually every chronic disease category. The polyphenol also protect the gut lining, supporting the integrity of the intestinal barrier that prevents harmful substances from passing from the gut into the bloodstream, a process that when compromised drives systemic inflammation throughout the body. The liver benefits directly and significantly from extra virgin olive oil. Research has found that oleic acid and olive oil polyphenol reduce fat accumulation in liver cells, reduce inflammatory signaling in liver tissue, and support the antioxidant defenses that protect liver cells from damage. For people who already have fatty liver disease, switching to extra virgin olive oil as the primary cooking fat and following a Mediterranean-style dietary pattern has been associated with meaningful improvements in liver enzyme levels and ultrasound markers of liver fat content. The blood sugar regulation effects of extra virgin olive oil are directly relevant for the large proportion of seniors managing prediabetes or type 2 diabetes. Research has found that consuming extra virgin olive oil as part of a meal reduces the postprandial blood sugar spike that would otherwise follow that meal, by slowing gastric emptying and modulating the enzymes involved in carbohydrate digestion. Over the long term, olive oil consumption has been associated with better insulin sensitivity and lower fasting blood glucose levels compared to diets dominated by other fats. Bone health is another area where olive oil's benefits are less commonly discussed but genuinely meaningful. Research has found that the polyphenol in extra virgin olive oil support bone mineralization and inhibit the activity of osteoclasts, the cells responsible for breaking down bone tissue. In populations with high olive oil consumption, better markers of bone density and lower rates of osteoporosis-related fractures have been observed. The skin also reflects olive oil's effects from internal consumption. The antioxidants in extra virgin olive oil, consumed as part of the diet, help protect skin cells from ultraviolet radiation-induced oxidative damage and from the glycation reactions between blood sugar and skin proteins that are responsible for much of the visible aging in skin structure. Regular dietary consumption of extra virgin olive oil has been associated in research with better skin hydration, reduced signs of photoaging, and overall slower visible skin aging compared to dietary patterns high in saturated fats and refined foods. Let's also spend time on something that ties all of these individual system benefits together in a unified framework, which is the concept of inflammaging. Inflammaging is a term coined by researchers to describe the chronic, low-grade, sterile inflammation that is now understood to be one of the most fundamental drivers of the aging process itself. As people age, the immune system becomes less regulated, producing a sustained background level of inflammatory signaling that damages tissues throughout the body at a slow but continuous rate. Reducing inflammaging is one of the central goals of longevity medicine, and extra virgin olive oil is one of the most comprehensively studied dietary interventions for doing exactly this. The way olive oil addresses inflammaging is through multiple simultaneous anti-inflammatory pathways that operate in different tissues throughout the body simultaneously, including oleocanthal's enzyme inhibition, hydroxytyrosol's antioxidant pathway activation, the gut microbiome support, the endothelial protection, the liver protection, and the brain polyphenol that reduce neuroinflammation. The concept of food synergy is also worth mentioning in the context of olive oil, because this helps explain why consuming extra virgin olive oil as part of a whole food Mediterranean dietary pattern produces effects that are larger than what olive oil alone would predict. Food synergy refers to the way that compounds in different foods interact with and amplify each other's biological effects when consumed together. The polyphenol in extra virgin olive oil interact synergistically with the lycopene in tomatoes, with the flavonoids in vegetables, with the omega-3 fatty acids in fish, and with plant compounds in legumes and whole grains to produce a combined anti-inflammatory and antioxidant effect that exceeds what any single compound would achieve in isolation. The Mediterranean dietary pattern, of which extra virgin olive oil is the cornerstone fat, is the most comprehensively researched dietary pattern in the world, and its effects on longevity, cardiovascular health, cognitive health, and cancer prevention are among the most consistently replicated findings in all of nutritional epidemiology. One more practical dimension worth covering is the cooking temperature consideration, because extra virgin olive oil's behavior under heat is frequently misunderstood in ways that lead people to use inferior fats for cooking under the mistaken belief that they are protecting the beneficial compounds. Extra virgin olive oil has a smoke point of approximately 190 to 210 degrees Celsius, which is well above the temperature required for most home cooking, including sautéing, roasting, and even shallow frying. Research examining what happens to extra virgin olive oil polyphenol at cooking temperatures has found that the polyphenol are largely preserved at temperatures used in standard cooking, and that the fatty acid profile remains stable under heat. More recently, research has found that cooking vegetables in extra virgin olive oil actually enhances the bioavailability of certain plant compounds in those vegetables. The practical implication is that replacing cooking fats with extra virgin olive oil across all forms of cooking provides the full range of benefits we have discussed without concern about destroying the beneficial compounds through normal home cooking temperatures. Before we close, it is important to say clearly that this video is for general educational and nutritional awareness only. Extra virgin olive oil is a food with an exceptional research record and a long history of safe, beneficial use as part of the human diet. However, it is not a medical treatment for any condition, and anyone managing specific health conditions should discuss dietary changes with their doctor or a registered dietitian. If this video gave you a genuinely new and more complete understanding of what extra virgin olive oil is doing inside your body every day, please share it with someone whose health you care about, because this is the kind of comprehensive, research-grounded nutritional understanding that most people never receive in one clear place. If you found this video helpful, please like it and subscribe to Dr. William Hart Health for more videos like this every day.